So give us about 5 more minutes and we're going to get started. We're just getting set up in person. Thank you. Good morning, everyone. Thank you all for being here and being on time. We will be starting in about 3 minutes. And we are also virtual, so we're in person, but we're also virtual. So just to let you all know, virtually, we will be starting in about 3 minutes. Okay, good morning, good morning. We're going to go ahead and get started. Thank you all for being here on today. We are here at our quarter three Safe and Supportive Communities Action Team meeting. Uh, for a reminder, for this meeting, we will be recording. So if those are virtually, if you can please mute yourself until asked to unmute, and video is welcome. So thank you for your participation in that. Next slide. So I'm gonna pass it over to Quinn Taylor, the co-chair for Safe and Supportive Communities for MKE Elevate. And he is also with the Office of Wellness and Safety, Crime and Neighborhood Safety. So I'm going to pass over to him for the rest of the slides.
Well, good morning, everyone. Wanted to give a good morning the way that my director, Shanti Hamilton, usually gives it with so much energy and enthusiasm. But my name is Quinn Taylor. I work for the Office of Community Wellness and Safety. I serve as a Community Violence Prevention Program Coordinator, formerly known as the Office of Violence Prevention. Like Robert mentioned, I'm the co-chair here with MKE Elevate. And as an office, we appreciate anytime we have the opportunity to collaborate and work with other organizations. So to share agreements, number one is to step up, step back. Number two, respect each other's time and expertise. Number three, support each other's learning process. Number four, evaluate the expertise of lived experience. That's one of our biggest contributions and opportunities that we have when serving communities that we serve is working with individuals that come with lived experiences. Is one of the ways we're able to connect with communities and others is through those lived experiences, but we also can help others navigate systems because of that experience. Number five, listen and understand and support. Number six, remember our North Star, the health of all people and neighborhoods in Milwaukee. Next slide, please. So the agenda is introduction and welcome as we're going over, me and Robert, the MKE Elevate overview that'll be conducted by Robert. MKE Elevate 2024 Smarty Goal Refining Exercise. That'll be our breakout session. That'll be going on in person and virtually also. And then a partner presentation that'll be done by Lutheran Family Services, Elliot, and also Lynn Lewis from Forum for Life, who's the director of Forum for Life. Then we'll go to our subcommittee updates, and then we'll wrap up and have closing remarks. Next slide. Now pass it over to Robert for our purpose of today's meeting.
Awesome, thank you, Quinn. And just to give some housekeeping, we do have bathrooms. If you have to use the bathrooms in person, you can go down the hall to your right. And then also, again, those that are virtually, feel free to use your, to mute yourself, but also to make sure that you, if you have something that you would like to share in the chat, feel free to use the chat. To continue on the purpose of today's meeting is to build relationships among this group of community members, to give updates about MKE Elevate, and then also to have MKE Elevate Safe and Supportive Communities 2024 strategies, Smarty Goals refining. So we want to go into breakout groups to discuss the framing of, because we've been working on a lot of the strategies, and so now we want to put them in Smarty Goals to help share our progress and to inform our progress as we go through the next coming of years. And then we would like to highlight our community partners to build awareness, and then also we would like to update everyone regarding our MKE Elevate Safe and Supportive Strategy subcommittees. So those will be the objectives for our meeting today. Next slide. So again, wanted to reiterate our vision and mission for MKE Elevate. So for the vision, we is to have a Milwaukee where all people are thriving in safe, healthy, and equitable neighborhoods. And our mission for MKE Elevate is to support a Milwaukee where all people are thriving in safe, healthy, and equitable neighborhoods free from oppression by aligning strategies and building power, partnerships, access to resources, and opportunities for collective advocacy in community identified priority areas. So we wanted to share that again to make sure that we are all aligned as we work towards our goal, which is to have to empower and have the healthiest city of Milwaukee and those that live in it. Next slide, next slide. All right, so just to reiterate, but not to over exaggerate, the overall of what MKE Elevate in the process. So our cycle process is repeated every 5 years. And so we've started with the evaluation and reassessing process, which we did with our community needs assessment. And so from there, we've provided engagement in the communities. We've done community events. We've been a part of door knocking. We also had a photo campaign. And so we received a lot of information to come up with our priority goals. And so we have set the priorities and goals with a number of our action teams. We have our built-in environment action team. We have our maternal and child health priorities action teams, and then we also have our safe and supportive communities action teams as well, which is all of you. And so we have set some priority goals, and so now we're at the collective action phase. And so everyone here are working on those actions, and so we have subcommittees that we have assembled to make sure that we are following up with action around those goals and priority areas. Next slide. So now I'm going to turn it over to Savani for our safe and supportive communities Smarty Goal activity exercise.
Thank you, Robert. My name is Savani, and I'm the Senior Epidemiologist at the City of Milwaukee Health Department. And I just wanted to give us some context today on what we're hoping to achieve out of this breakout activity, where we currently are, and what we hope to do with the results from today. So based on prior action team meetings, as well as subcommittee meetings, our team has worked to compile everyone's thoughts into initial Smarty goals for each area. So our next step today is to break out into smaller groups and to refine and finalize these goals. Specifically, we'll be focusing on these following aspects: the objective, which involves defining what we aim to achieve and ensuring that it's a Smarty goal; the deliverable, which includes clarifying the expected outcomes of our collective work; the context, outlining why we're focusing on this area, as well as including a brief overview of the current situation in Milwaukee; input activities, which involves identifying the specific activities that we will collectively be doing to help us achieve our deliverable; as well as setting a baseline for measurement, which involves establishing the current baseline, but if there isn't and it's a new metric, then identifying that it's a new metric, and we'll have to figure out how we want to go about best measuring it; and the data source for measurement, if the data is currently being collected, which partners have access to this data. And once we determine these elements, our data team will reach out to the relevant partners identified so that we can gather that necessary baseline data. And moving forward, some of our next steps will involve setting clear targets for success and beginning the work on input activities so that we are able to complete our deliverable and achieve our objective on time. And the structured approach will help ensure that our goals are both actionable and aligned with our overall vision and mission, as Robert had mentioned. So with that, we were hoping to get into groups.
Yes. Thank you, Silvani. And so for those that are virtual, we're asking that if you could put in the chat your interest of priority area, so we can be able to break you out into groups of your desire of interest or that you currently are working in. And so for those that are in person, if you could, we're going to have breakout session 2 with breakout groups. So if there are specific areas that you're interested in, so we have 4 priority areas. We have crime and neighborhood safety. We also have mental health. We have the domestic violence and interpersonal violence, and then we have harm reduction around substance misuse. So we will make sure that you could go into groups. So we're going to have the crime and neighborhood safety here where Yusuf is. And then we're going to have the mental health here where Daryl is. And then we'll have the domestic violence and interpersonal violence where Ben is, if that's okay. Not to say that you all will be facilitating it, but just so we can have structure of where they will be located. And then if we could have a moment to just go into those groups now, and then I will be selecting we organizing in the virtual space.
Give everyone just another second, but it's looking like we have mostly some mental health and crime and neighborhood safety. So we could do 2 virtual breakout groups, and Melissa and I can each lead one in those 2 areas. I'll give folks a second if you have any objections. Okay, great. Then Melissa, do you want to answer? Do you want to do mental health or crime and neighborhood safety?
I have been joining the mental health work group meetings, so I can do that one since I'm already a bit familiar with it.
Perfect. Okay, so what I'm going to do now is I am going to open up a breakout group for folks joining us virtually that'll go with Melissa. So if you're interested in talking about mental health, please select the option to join this group. And if you are more interested in talking about crime and neighborhood safety, just stay in this main room, and and then we'll talk about crime and neighborhood safety right here. And let participants choose the room. And feel free to unmute yourself if I'm opening up the room right now, but feel free to unmute yourself if you want to join that breakout group, but you're not seeing the option and I can move you over.
So mental health is joining me in room 1.
And then I'll give it another like 60 seconds. And if anyone wants to move over, just feel free to put it in the chat or unmute yourself and I will get you over to talk about mental health.
This is Aaron Lipsky, MFD. I'm only seeing breakout room 1.
Yes, so breakout room 1 is going to be to talk about mental health. Do you want to talk about mental health?
I was looking at harm reduction.
Okay, oh, Alex,
I'm
do
over
you
Mr.
have the capacity to lead a group on harm reduction here?
Yeah, if you want to put me into the make another breakout room, and then I could do that one.
Cool. Okay, so I'm gonna have to kick everyone out. Give me 1 second and I will do that.
Sorry.
No, appreciate it. We're flexible. All right, okay, round two. So we have enough people that are interested in talking about harm reduction, and Alex is here to facilitate that. So we are going to have two different groups. One is room one, and I'll name it this time so it's easier to navigate. One is going to talk about mental health with Melissa. And then room two is going to talk about harm reduction with Alex. And then if you're interested in talking about crime and neighborhood safety, you're going to stay in here with me. And feel free to just unmute yourself and let me know if you want me to move you over, if that's easier too. Are there any questions? Appreciate everyone's flexibility this morning.
And Amanda, if you could move Albert into mental health, that would be helpful.
There you go. And then while we're doing that, I'm going to pull up our discussion questions. All right, does anyone else need to be moved anywhere? Otherwise, I'll assume we're all going to talk about crime and neighborhood safety.
Amanda, sorry, I don't see the breakout rooms. This is Barrett. Can you move me to harm reduction?
Yes.
Thank you.
It'd be like a pop-up that you get.
Oh,
So if
okay, thank you.
but let me know if anyone else wants to be moved over. But I'm going to pull up our guide so we can take a look at what we're discussing today. Okay, so we are going to talk about, so this is the goal as we currently have it, and then we're going to go through these highlighted discussion questions. So I'm going to give everyone a little time to read this. Ours are nice and short, so it should have, can fit Zoom, but let me know if anyone is having trouble seeing it. And I'll give you a little while to absorb this, think about it, and then we'll launch into the questions. Oh, Renee, I will move you over to mental health. All right, feel free to continue like thinking, reading, and talking, but I just wanted to open up the discussion to this first question on the deliverables. So thinking about crime and neighborhood safety, what do we see as the specific like outcome or product of our work together that we can accomplish by at the end of next year, December 2025? Feel free to unmute yourself or put it in the chat.
I think from is it the action team, the regular meeting we've been having, Robert? Um, the deliverable, a deliverable could be, that work with VR Fast, so just, that collaboration or whatever that looks like, kind of getting that solidified.
We are fast. Okay, do you have any more details on that? Like, is there a product or report that VR Fast is working towards?
Charlie, I don't know if you want to jump in, but we've been talking about, the group as like a facet of VR Fast. I'm not sure exactly what it was decided upon what that could look like. But just not reinventing the wheel since VR Fast already has a lot of folks at the table, which is already really breaking down those existing silos.
Yeah, thanks for that, Leilani. Yeah, so I can jump in a little bit on that. So yeah, I know in our last meeting that we had with the smaller group, it was we discussed potential collaborations with the VR Fast. So that's the Violence Response Public Health and Safety Team. We're a collaborative led through the Medical College Wisconsin that we've been running the team since I think 2020. So it's been in existence for a while, but has a lot of the partners that we, this goal is trying to bring together already at the table. So we discussed kind of ways that we could collaborate. So I think a component of this is really, just that piece of bringing agencies together. To kind of share their work and try to collaborate on things. So I think that we had come to somewhat of a decision that that we were going to piggyback off some of the VR Fast work for this. So I'm not entirely sure if we kind of nailed down what that's going to look like, but essentially, we could have this a component of the VR Fast. We have goals and strategies there as well. So this could be included there.
So do you have, is someone who is a part of, or either of you a part of VR Fast, or do you have like a plan to work through what those details look like, or?
So I'm the main analyst that works with the VR Fast work. So I lead a lot of that component. Connie Koslak is the kind of the main lead on the project, but yeah, we do have, we can share more information. I know we had shared maps showing the overlap of program priority areas, so the different programs at Medical College, along with some of the promise zones. So we shared some of those program priority area maps, just to kind of highlight some of the overlap with our work. So I know that's one piece that we've provided, but
I know that Robert and Justin Rivas from the Healthcare Partnership were putting together, I don't know if it was like a request or something to VR Fast to really lay out what that collaboration could look like.
Great.
Yeah, I know one of the ideas is so we have various action teams that are underneath that umbrella, but so I think that was part of the discussion is potentially having this kind of be its own action team of folks that are involved with this, as well as VR Fast. So that was one idea.
And are there like specific products that the overall VR Fast project is working towards, or outcomes?
Yeah, I mean, it's all focused on reducing violence in Milwaukee. We're primarily focused, it's just mostly citywide. We don't really expand much beyond the city. We work primarily, the data at least comes from the Milwaukee Police Department, so it's mostly citywide data that we're looking at. We have a focus area identified in the city. It's made up of I think it's like 30 census tracts. So it's some analysis that we did looking at hotspots and various other crime metrics for violence, so homicides, non-fatal shootings, shot spotter data, firearm related aggravated assaults, and identified areas in the city that had higher occurrence of those. So we do have like a focus area that's identified with micro hotspots within that focus area for additional focus. And then we have, strategies and various intervention plans that we'll be targeting those areas. So, yeah, I know there's like a few example, like one example is we partnered with some folks doing stop the bleed trainings, and so we identified areas in the city that we could potentially deploy some of those kits to. Yeah, it's just like, yeah, trying to, and then there's like schools within the area that we've focused, we've done some trainings and provided some additional resources and education too that were in the focus area, just things like that. So it's kind of some examples of some of those pieces. Yeah, Leilani, anything else we can add?
No, I think that's good.
So, yeah,
So
I
is
mean,
there, yeah,
I was
No,
gonna
go
say
ahead.
that to it, that we don't have like identified like we don't have like, we want a reduction in homicides of 60% over the next year. Like we don't have like identified goals like that. So I think that is a gap kind of in some of our work that I think potentially some of this work could help fill is maybe setting some metrics or things that we could actually measure and focus on to measure progress. So I think that could be a component of this, but yeah, I was kind of thinking out loud.
No, that's great. This is really helpful context. Appreciate it. Just trying to move us a little closer towards getting some kind of clearer outcomes or how we can figure out a way to get there together. Is there any other thoughts on like the outcome of this work for this work group specifically? Or do we want to move on to one of these other questions?
Well, I know that so if you scroll up a little bit, I think the objective does mention kind of like equitable resource allocation. So I don't know if we're really touching on that with some of these deliverables, but yeah, that could also, I'm trying to think, if there could be, I guess maybe just additional discussion around that. Yeah, kind of what that looks like and how we could maybe implement that more, maybe in the VR fast work or with this. Yeah, I think that there's definitely a lot of room there still for discussion, and I'm not entirely sure what that would look like.
That's a great point. Does anyone have any like visions or ideas for what we would want in terms of like equitable resource allocation? Clarifying what that means to folks.
Yeah, I think, a component of this is, looking at the environment, like these priority areas that I meant, like the maps we created. There could be some analysis looking at that to determine are these areas, looking at, SES measures or things like that, are these areas that, do have lower resource that need more attention? Are we focusing on the right areas type of thing? Maybe based on some of those kind of more social economic stat measures.
That's a great idea. And then do we currently have a way to measure like resource allocation? And then like what resource allocation are we looking at? Are we looking at the specific like funding that our partner organizations or like We Are Fast are funding, or is it just like overall investment in the city? Spark some thoughts and questions.
Yeah, I think those are good questions. And yeah, let's chime in again. But yeah, I think that there's these priority areas that are identified, but that doesn't mean that like that's, then, a lot of resources even going into that area. It could just be, a focus of analysis or, data, kind of things like that. So yeah, I think there probably could be more granular kind of look at what exactly we mean by resource allocation. Is that actually like funding going into an area? Is that is that engagement in an area? Is that events pop up? I don't know, just trying to, yeah, like those, like what does that actually look like? What are we talking about when we're talking about resource? Yeah.
Yeah, does anyone have any thoughts or want to expand on that?
Yeah, I would probably define it more as like you know, what actual services and engagement are you providing to the area? And that can be like, you know, human resource. If you are doing community, you know, violence interruption, that's, you know, that is to me like a resource. But yeah, that's kind of how I think I would define it, but open to suggestions on that.
I think that's a great start. And let's see, neighborhoods, yeah. Another piece of this that maybe we don't have a specific outcome for, but maybe we can open up discussion around is like, what does it really look like to break down the existing silos? Or is there a outcome or a goal, or ideas of how we could potentially measure looking at doing that? Or even like, even just what kind of activities would we want to do together to work on breaking down those existing silos?
Yeah, I'll jump in again. I think the VR Fast does a good job with this specifically, just because we do have a lot of partners at the table right now. So I think it'd be a huge piece is just communication and consistent communication. So we do have 2 meetings every month with our full group. We have facilitation team meetings every week. Our analyst team meets weekly, and those are all, you know, partners from public safety, public health, you know, community partners. So we do have a lot of people at that table. So I think that there is yeah, I think that those are kind of being broken, but the work's being shared across those agencies at those meetings. So I think that's a big component. It's just the communication. But yeah, as far as measuring that, I don't know if I think there was mention on a previous call of like actually like counting the number of different partners that are at the table, like how many people are sharing, you know, their work. I mean, how many people are consistently engaged with you know, communicating during some of these collaborative meetings.
Sounds great. Okay, then how about, okay, so we still need some refinement on some of those areas. So let's think about maybe that refinement as the activity we want to do. Like, what activities would we need to do to decide on our goal, our more specific goal for like equitable resource allocation, and or for the setting the specific objectives for the goal? What kind of activities would we want to do over the next year to get us to that point of clarity? And or accomplish that larger goal?
I think maybe really addressing what is meant by equitable resource allocation, because then if, for example, we are at the VR Fast table, then we can make specific asks of partners. So right now the conversation is more filling in the gaps in service. But what, you know, if we're breaking down the silos by having all of these folks at the table already, what would be the specific ask of them in terms of allocating resources in an equitable way?
That's a great point. And does that look like having a conversation?
Yeah, I think the first piece of it would be that that ask that Robert and Justin are putting together. And then moving forward as in collaboration with VR Fast. And then once this group is at the table, you know, whether we count the number of different partners or really just have an understanding of who each partner is, what they have to offer, and then making that specific ask.
That sounds like a great plan. Are there any other like key activities we want to do to accomplish this overall objective? Now maybe so just quickly look at, so we have these measurements from mostly coming from MPD crime data, it looks like. And there's a question about like, how is the data being collected? Does anyone have any insight into this?
Yeah, I can speak a little bit to that. I'm not sure where this data specifically got pulled from, but I do work with MPD crime data. They do have one of the unique things about MPD is they do have quite thorough information on our non-fatal shootings. So they do collect primary factors, and that's actually available in the you know, an analyzable data set. So that's what I work with, but there also is just information from you know, their RMS system, which collects, you know, just incident-based crime data, which I think was be like, you know, where like the carjacking, theft, burglary, where a lot of that additional data comes from. So those are the main data sources there. But I think one thing I would add to this is kind of just speaking to what I was talking about earlier, is some of the more social economic information and data. So I think kind of measuring some of those pieces, I think will help get us at some of that, you know, equitable resource allocation component to this.
So is that looking at things like the social vulnerability index of looking at like
Yeah, so
percentage of
SVI
folks
is
in poverty, or yeah.
exactly, yeah. So SVI is a good measure. You can look at that at a pretty granular level too, like census tract. I think even maybe smaller than that. So that does give you information. It's not always easy to like, you know, to transpose that into like neighborhood information because it doesn't line up perfectly with those boundaries. But yeah, that's like, yeah, SVI is one of we've looked at, you know, like the percent that have health insurance in an area. You can look at the percents that are under the poverty threshold. You can look at I think I actually just sent a message to someone recently on this, but yeah, we pulled some of those measures. Looks like we also, yeah, we can look at like owner occupied housing is another component of that, but that's all available through like the census website. And you
Yep.
can get that at like the census tract level. So those are some examples of things we've looked at that are kind of socioeconomic related data, but definitely there's more out there than that for sure.
So is there anything else anyone is interested in discussing? So then I think maybe we can return to this. I know we've talked about it a little bit, but is there anything more we want to define, or any differences in opinions around like a good way that we'd like to approach equitable resource allocation, or what that means to like each of us in this group? Here were some ideas that were presented. not, we could take like just a quick, I think we'll come back in about 4 minutes for our next partner presentation. But if folks need a second to like catch their breath, we can do that for the next couple of minutes. Or if anyone wants to hear a little bit of what they're talking about in the mental health or harm reduction groups, I can move you over there if you want to participate in more than one. Just let me know. Hey, Robert, our group wrapped up our conversation just a little bit early, so we're taking a quick break. But if you can get me the slides, then I can have them ready to pull up for the partner presentation.
Sounds good. Sounds good. Thank you. Can you hear me?
Yes.
Okay, yep, so I'm finna send it over now, and I'll if we can break the groups, we'll bring the groups back in about what? Uh about 5-10 minutes? Or 5?
Okay.
All right.
I don't know if we need 5 more minutes.
Okay, so we can start I'm bringing everyone back, and I'll get the others in person back together.
Sounds good. think we're taking a quick break as people are regrouping. So if any of the groups like needed another second to finish up their conversation, you feel free to do that.
All right, everyone, we're gonna go back into our full group. And if you need a little break before our presentations, you can definitely take a phone. I did not.
Before those breakout sessions. If not, I have it up. I know that'll be a problem for those online.
Yeah.
Is there audio right now? No? Okay.
We can start it in about 2 minutes.
Thank you, thank you.
We're back in session. Thank you all for joining the different breakout groups. Hopefully you had some enlightening and informational conversations to help guide this work. Next, I want to introduce one of our facilitation partners. This individual really doesn't need an introduction when we talk about CVI work in the city of Milwaukee. And CVI is Community Violence Intervention. This person, when talking about leading and shaping individuals, that comes with lived experiences. When you talk about some of the situations that we deal with in regards to retaliatory violence, gang violence, and how to respond with empathy and sympathy, but also in a lens where it's heavily involved with males and male perspective, to have a Black female to be able to excel and reach heights that Lynn Lewis has really speaks volumes to her work, to her expertise and the knowledge that she brings. Lynn Lewis, the director of Forum for Life, is not only a facilitation partner, but a dear friend to the Office of Community Wellness and Safety, and also myself, Lynn.
Ooh, look at that introduction. You would think I was getting an award today. What? Thank you, Quinn. And let me see, I've been asking all morning. Is it morning or afternoon? Yeah, it's still morning, y'all. So good morning. So I only have a couple minutes, so I'll be brief, but I'm happy to be in this space. Again, Lynn Lewis, Director of 414 Life. Yeah, I've been doing this a long time on the county side, helping with implementing credible messengers, and then having an opportunity to come over to Medical College of Wisconsin 414 Life. And this work is fire. And what I've learned that is you have to partner, because not one agency or program or organization can do it by yourself. It takes all of this online, all of this that's in the room. It takes us talking and collaborating together. So let me dive into this PowerPoint real quick. Some of you are very versed on 414 Life, but I'll just do a brief overview of the work. So there's a couple things that I want to share about 414 Life that a lot of people don't know, right? There are 4 components to our program. We have the hospital component. Those are the individuals who work with Freighter Hospital. They go in real time to engage with families and patients that are impacted by gun violence, right? And also fear, safety, or retaliation. We have our community engagement coordinator that works alongside our outreach worker on the street side of things, and our VI interrupters as well. And then we are also, many of you don't know, but we are a program of Office of Wellness and Community Safety, employed in collaboration with Medical College of Wisconsin. And we're not only in Freighter Hospital that has the #1 trauma bay, but we recently are now in St. Joseph and Aurora Sinai. And then just, let me see, has it been a year yet? Quite not a year, but we are also a member of HOBBY, which is the Health Alliance for Violence Intervention. So that was a really big deal for us. And then what keeps us afloat and keeps us paid in doing this work is the funding that we have with Annie E. Casey. Of course, the City of Wellness and Community Safety, Freighter Hospital, GMC, or the Greater Milwaukee Fund, the Kellner Family Fund, and then Milwaukee County Department of Health and Human Services with the Credible Messenger contract. And then just a couple of things regarding the program and, you know, what our aim is. And of course, that is to prevent and interrupt the transmission of violence. And we do that using our three-prong process. And when I say three-prong, I'm talking about identifying and detecting, right? That's what our entire team are trained to be able to do on the hospital side and on the community side, right? Keeping your ear to the ground on what's going on in the community. Of course, you all know, and if you don't, we have target areas. We have Old North Milwaukee, and then we have Walker's Point. And the role of our VI team, our outreach team, is not only to know who the residents are, but who the business owners are. And then for our VIs to keep an eye on what's going on in those areas, and being ahead of any type of conflict that may be brewing. And if it is, that they're engaging with that mediation, that interruption. That's that targeted intervention. That's aim number 2, right? And then that third prong is the change in the community norms. And what does that look like for our team? That's doing that daily canvassing, right? In Old North Milwaukee, and Walker's Point. And then if any of our 5 credible or 6 credible messenger agencies, if Office of Wellness Community Safety calls and, you know, they need assistance anywhere else in the community, our team is there to respond as well. So having that pub education, right? We have cars that has all the components of 414 Life. We provide gun locks to families and communities. We show them how to utilize the gun locks, and then we provide those resources to be able to change that norm about what violence looks like, how to resolve and cool off conflict, and who to contact when emotions are high. And then just the program structure, of course, we work with the highest risk individuals between the ages of 15 and 35. And yes, we have worked with those who are younger and those who are older, but that's, you know, that's the structure. And of course, I just broke down the 2 main components, which is the community side and the hospital side. A little bit of history here regarding, you know, when things got started up. You have a community side and a hospital side. With the community starting in October of 2018, hospital side May of 2019. Our team now consists of, again, our hospital responders that when we first started, it was 1 hospital responder, Miss Tania, and I always shout her out because that was a task. But now we have 3 wonderful hospital responders, a hospital supervisor, and we have an opening for 1 hospital responder. And then on our street side, we have our community program coordinator, we have our violence interrupter supervisor, our violence interrupter lead, and then we have 3 VIs, and we're still looking to hire 3. And then our outreach team is fully staffed with 1 outreach supervisor. We do need a lead, and then we have our outreach workers as well. And then it just talks about, you know, what our aim is and our goal, which is, of course, is to interrupt, cool, and stabilize situations, and also be able to provide resources for continuum of care for those families who are impacted by gun violence. And this is just talking more about, you know, the activities that we do, the conflict de-escalation and mediations. We do that in the community. We do that with our referrals, and I'll talk about the referrals in a little bit and how we receive them. We do that through street outreach and community engagement, and of course, how our hospital responders respond to the hospital in real time. They get a page, right? It has the patient's name, the incident summary, and then what the concern is, right? If there's safety or retaliation, and it needs to happen right away. our team is there. Our hospital responders are there. If we have family members that are in Freighter or Sinai Roar or St. Joseph's, who have family members who are there, they have high emotions, and our team is trying to work with the patient, then our street team comes and assists in that manner. As it relates to how referrals come to 414 Life, of course, they come through the hospital, right? And I'll show that. There's a different slide here that shows that a little bit more in detail, but hospital responders send referrals out to our community side of the team to either do that mediation type of work or that resource work, right? Plugging those families in with resources so that they have quality of care after a gunshot wound. And so we also receive referrals through Office of Wellness and Community Safety. With those referrals that are elevated to some type of safety or some type of retaliation concern that's happening, our team engages with those families as well. And of course, we receive referrals from the community. Our teams are also in several different high schools and I think one middle school, and we're also in the detention centers. And these are just a couple highlights. The numbers have changed. I think when we put the slide together was back in April. But just some things I wanted to shout out the team is that there has been 241 hours of violence interruptions. 110 hours of interruptions were in our targeted areas and 44 hours were outside of the target areas. Our canvassing efforts from last April to this April resulted in 943 people being contacted and over 3,500 pieces of public education was distributed. Behavior change in public activities, those canvassing situations, those shooting responses, the different things we do with our youth every Friday equated to 748 hours were logged by our street teams. And then for the month of April, we can speak on that there were 0 violent incidents in Walker's Point, and that there were 3 in Old North Milwaukee, being 1 homicide and 2 non-fatal. So the thing here is that we apply pressure every single day in those targeted neighborhoods in hopes of seeing gun violence decrease. And so, 414 is doing that. Other agencies are doing that. You have VRFast, that look at hotspots. And so we are applying pressure in the neighborhoods and the blocks that have the highest risk for gunplay, right? And being on not only that intervention side, but that prevention side of the work. Okay, a little bit about hospital component. I'll skip over that. So this is what I'll lift up and then I'll give the floor back to you, Quinn. And so, with violence prevention and being under the Medical College of Wisconsin, we are really taking gun violence and looking at it from a public health lens, right? And so what that looks like for our team and for Freighter Hospital and now Aurora Sinai and St. Joseph's is what it looks like when a patient comes in. There is fear of safety and retaliation. The social workers at Freighter are really trying. They care, and I think that's the main thing. They care and they are not afraid to be able to listen to law enforcement, to be able to listen to families, be able to listen to patients. And although they're not talking to the social workers directly sometimes, those social workers are keying in on those very things that we need to be able to get out that call and get in front of that situation if there is a retaliation concern. And so the social workers are gonna say, okay, low risk, nothing really popping off, right? They may need resources, social workers get them what they need. If it's high risk, they're gonna send out that page, right? The page comes through as an email. Our entire team is 24/7, right? Our hospital responders, they have on call, so they may do their 8 to 4 or 8 to 5, but there's somebody on call the rest of the day, right? And throughout the night. And then our hospitals, they follow up and do their assessment, and I'll show you all the assessment before I turn it over here. So our hospital responders, they go in and they have like a conversation about what happened, dive a little deeper into concerns from the patient if they're able to speak and with the families. And these are some of the assessments, y'all. But the ones that keeps coming up consistently on what the needs are, and this was as of April, and that changes sometimes, is mental health, financial, employment, things like that. Housing is huge, and then retaliation, right? That's a real thing. And then just a couple highlights for hospital. So in April, let me see, 1,421 total program referrals since the start of the program component of 2019. I think we're up to 1,500 now. This was as of April, it was 1,400. And then the beginning of March, of course, we started to build our capacity to be in other hospitals. And so October or November of last year, we were in St. Joe's, and then just recently, we are now working with Aurora Sinai. Let's see. I'm just seeing some other things. Yep, covered that. And that's it, y'all. Any questions? All right.
Thank you so
Thank
much.
you.
Appreciate that.
Absolutely.
Right, thank you so much. What an informal and a very a great presentation of the work that is happening in the city of Milwaukee. We're gonna now also have, we have a clap by our Melissa virtual. Yeah, it's a head clap. Was there any questions or that anyone had regarding the presentation? Okay, so I'm gonna stop sharing my screen. And now we have one other presenter, one of our new implementation partners from Lutheran Family Services. We have Amanda and Kim that will be coming up to talk about their initiative amongst the community, the collective for powerful action. All right, so we're gonna transition here. We're gonna have Amanda share her screen. All right, thank you. Thank you.
All right, thank you. I just want to make sure that everybody online can hear us as well. Because I muted myself on my computer.
Yes, we're hearing you and seeing the screens.
Awesome. All right, so thank you. We are from Lutheran Social Services, and we wanted to come and talk to you all about some of the work that we have going on. So my name is Amanda Kraskowski, and I am the Director of Performance and Quality Improvement at LSS. And Kim Fulke is one of the members of our team who is also a Senior PQI Analyst. And today we're just going to cover a few things, give you a very brief introduction to Lutheran Social Services, look at our social determinants of health and the work that we're doing there as it is combined with our school-centered mental health program, and then our Wisconsin partnership project that we have moving forward. So with Lutheran Social Services, we provide services throughout the state of Wisconsin that reaches a lifespan, everything from foster care, adoption, birth to 3 programs, to mental health services, to helping individuals stay in their home. We cover all 72 counties in Wisconsin. We also serve 5 counties in the Upper Peninsula of Michigan. We see around over 14,000 individual clients a year, plus their families, and we have over 800 employees. So you can see some of our services up there that on the screen that we have. So we're a fairly big organization. And part of our social determinants of health journey, so we started this about 5 years ago where we really wanted to start to collect data and look at social determinants of health of the clients that we see. So we have a screener that we use at both intake and then at discharge with most of our programs, all of our community-based programs. And this is just one of our data slides that we look at to see how many screeners do we send out in a year. So within 2023, we had, you can see over 3,500 statewide. In the Milwaukee County, we had over 842 screeners that we completed. And so far this year, we're on track to outdo that. We're looking at 3,400 statewide and 813 in Milwaukee County, and we will have more as the year goes on. And I'll turn it over to Kim to talk about our school-centered mental health.
So while we were developing our school or our social determinants of health screener, we were also kicking off our school-centered mental health program. And while LSS has a long history of providing school-based mental health services, we shifted our focus to the school-centered mental health model, where every family that receives school-based mental health services also receives a coach. So there's a therapist always working in tandem with the coach. And this also meant, because these things were sort of happening at the same time, that our school-centered mental health program was also our first program that was implementing or using our social determinants of health screener. And we've learned that the coach has been really key to engagement, because while a therapist is sort of back to back with their therapy appointments during the day, because the coach is working as their partner, they have that flexibility to really be reaching out to families and doing all the rescheduling it takes to get to the point of an intake. Families have a lot going on, they're really busy. And it's been really key to have that coach that can really sort of focus on really getting families through the door and engaging with them and really building those relationships. And so not only does the coach and the therapist work in hand, which has been really key, but that communication with our LSS team and the school team and meeting regularly and communicating has really been key as we've moved forward with our school-centered mental health model. And here's just more about what makes the family coach special. So not only are they the ones doing the social determinant screener, they're also doing our other assessments that we use to measure impact and sort of identify needs for the family. Working with families for the coaches looks different for every family. So they're really there to just sort of sit down with the families and walk alongside them and really say, how can I best serve you in this moment? And then connect them to other services in the community and really have that look like a warm handoff instead of a name and number written on a piece of paper. And they also, you know, while the therapist sort of is in the school providing those therapeutic services, the coach is out there in the community. So they'll go into the home or wherever the family feels most comfortable and meet them where they're at. So ultimately, the coach has been just so fundamental for this model in creating relationships and engaging families. And now Amanda's going to tell you more about why we're here today.
So back in February, we were awarded a Wisconsin Partnership Program grant. And essentially it was really focused on social determinants of health and doing research on the screener and what the needs are in the city of Milwaukee. So we were awarded, this is just a brief glance at it, close to $500,000. Some of that going towards services to help pay for those coaches, because that's the one part that is not reimbursable in our model that we're trying to change. We're trying to collect data on the social determinants of health. And so it also pays for some of that research and our academic partner, who are these individuals on their screen. Joshua, Dimitri, and Allison are working with us out of the Institute for Child and Family Wellbeing through UWM, and they're helping us with our research and moving it forward. They're interviewing staff, they're going to be interviewing families that have been a part of the program as well as families that are not part of the program. And then we have also tried to engage community stakeholders through our services. So we do offer parent cafes. Our coaches run parent cafes in the schools we're in. And that is open for families that we serve and any other family within the school. So they bring in services for families to kind of get to know, introduce them to what's out there. They also might bring in somebody to do more of an educational parent cafe, but it's also a chance for parents to come together and meet each other. We also are going to be looking at results-based facilitation training. So this is training that is really going to focus on how do you move a community level result and how do you train community members, community partners to focus on something together to know what everybody's piece of that puzzle is to really move the needle for the city. And we're bringing somebody in from out of state for that. And then just looking at that community data collection. So looking at our social determinants of health along with the other mental health assessments that we do with our clients that we have in the school center mental health program. But then also looking at the data that UWM will be collecting. So one of the things that we wrote into our grant that we really wanted to be a part of is we wanted to have some sort of community group, some sort of community coalition. And our idea going into the grant was looking at community partners. And after we started doing more research, we realized there are a lot of community partners already in this space and we don't want to duplicate efforts. So we looked at and we asked around and met with Robert and kind of asked like, where is the need? How can we help move these efforts forward that are already happening? And what we heard over and over again is we need community voices in the spaces where decisions are being made about the community. And so we're going to be holding a collective, we're calling it Collective for Powerful Action, where we meet with community members, give them training, and create partnerships with organizations that will allow those community members then to be in those spaces. So training them to be on boards for organizations, training them to be a part of action teams that we're all here for today, and giving people access. So as part of that, we're hoping that you all can help us find community members who might be a really good fit for this. We've had 5 individuals as of this morning that are interested, and we're looking for an additional 5 to 7 community members to join us. And part of the commitment is looking at attending a 2-day results-based facilitation training coming up in October, and then again in February. As well as having opportunities for other trainings, but we really want to make this like a cohort of community members who can now come together, go out into the community, use their stories, use their voices, but still stay a cohort where they then use each other and talk to each other about I'm on this board or I'm part of this action team and having trouble. How might I, what can I say? What can I do? And have them learn from each other in these spaces as to what is going on. So we do have some flyers with us today for those who are in person. Otherwise, you can also always email myself. I can give information to Robert to hand out to everybody that is on the call today. But we were really hoping to ask you all to help us find the right community members for this. And we're not looking for individuals who are doing this day in and day out, who have already been in the work. We're looking at new people who have the passion, who want to do something, but maybe don't have an outlet or feel like they don't have the experience or are nervous to go into those spaces. So please let us know if you have anybody in mind. There is an online form that they can submit. We can send you the link for that. And then with this last screen, just wanted to highlight, we were recently highlighted with Lutheran Services in America. They did a case study on us for the work that we've been doing with our social determinants of health within the state, but in the city of Milwaukee as well. And it has been now highlighted with them nationally. So that is very exciting. And we're excited to start to move forward with this grant in the community group. Thank you.
Awesome. Thank you so much, Amanda and Kim. We truly appreciate your willingness and your efforts through your initiatives and the work that you are doing. And so we are now coming to an end for the meeting. Just wanted to wrap up with a couple of items. So just for next steps, we will continue to meet with relationships. We will have our action team work groups and subcommittee to confirm that our action plans and take all the feedback that we got from today and to make sure that we include the content and how we drive our work. And then we will also have continue our working data inventory plan. So we will be reaching out to our implementation partners to continue that work. And then we will also have more training opportunities as we go forward into the end of the year. So again, thank you to all of our presenters. I will make sure to get the information to you regarding all of the content information from our presenters. Next slide. Also, in person, we have cards with our community health needs survey. So feel free to take those with you to complete those. It helps us drive our next community health needs assessment for all the health systems and the work that they are doing in all of our efforts. So the next the deadline will be September 1st. So if you could complete them as soon as possible, you can also, those are online, you can go to the link to get more material. So please share that. Next slide. Our future meeting, we have our next Safe and Supportive Community Action Team meeting will be November 21st. It will still be at 10:30 to 12. That was a misprint that's on the screen, but we're hoping we want to, because it's going to be more of in the winter months, we may move towards Zoom. And then we also, if you have interest in any of the other MKE Elevate Action Team meetings, you can, they will also be available online. It's next slide. And thank you. So again, appreciate everyone. If you have any questions or need more information, feel free to reach out to me, or you can go to our email link, which is at mkeelevate at milwaukee.gov. And so I also will be sending out a meeting evaluation, because we want to make sure that we're getting better and better at these meetings, and that is more impactful for those that are attending. Again, we will send it out, make sure that you fill that out as well. And if you are interested, or you know anyone interested in being an implementation partner, you can always reach out to myself or the online link. All right, thank you. Thank you all so much. Enjoy the rest of your afternoon. Thank you.
Thanks.
Have a great day.
Thank you all.